The body's made of cells. Cells are made of atoms and electrons. They have electrical properties. And over 100 trillion cells in the normal human body, constantly producing more. And as these cells are being died and coming back, sometimes something happens and some type of mutation occurs, and all of a sudden we have a cancer cell. This cancer cell can be a real problem and can kill people. The causes of cancer are mostly toxins, creating an intrusion in the chemical process of the DNA and the RNA. We call them carcinogens. And also radiation can also do this. That has effect. And then it's up to the immune system to destroy these cells. Once the mutation gets into the DNA, so through some toxic event, or possibly a virus, then it's up to the immune system to seek out and destroy these cells. And when that doesn't happen, then cancer gets opportunistic and grows on its own. Cancer can be really helping you to detox, but also cancer can kill if your immune system is not good enough to handle the onslaught of the cancer. Now let's learn a little bit more. There's many things in our lifestyle that affect cancer, and there's foods that actually feed cancer. And by far, the worst food in feeding cancer, the white processed sugar, the white processed flours, and these synthetic chemicals, these things are by far the worst. And there's other factors that interfere with the immune system that aggravate cancer. And many people have made natural remedies, energetic remedies, to help with cancer. And we're going to take a look at a few of those and how they have helped. Now we're going to look at a Dr. Burzynskis, his formula. And basically he's using a synthetic formula, a synthetic variation. It's not natural. And he did not obey all the rules in testing. It's very complicated to be able to do types of experimentation. And I can tell you because I've been able to do it. And I've had to take lots of courses from the FDA in order to learn this. Now let's watch a little bit about his history and see how it turns out in 2017, later in the film.
It is very difficult to obtain permission to treat patients in the United States.
We've been fighting this battle for way too many years.
Without this treatment, my son will die.
I remember sitting on her lap, looking up at her, wondering why she was crying. I was obviously just a kid.
I think this country has the finest bureaucratic regulations in the world, and the other countries are way behind.
Cancer is a major business in the country. If you have ideas that might in one way or another jeopardize that economic base, you fall into disfavor very quickly.
You're suggesting that there may even be a conspiracy against cure in a country that has declared war on cancer.
Without a doubt.
What people go through with cancer, and since 1967 you've been saying, I can take care of that, and people are going, forget it, don't pay any attention. Are we that backward, doctor?
Yes.
Well, what do you mean?
Yes.
Are we that backward?
Yeah.
I was told I had a fatal cancer and that they would treat me for a while with chemo and radiation, but eventually I would die of the disease.
Did you die from the disease?
No, I'm here today, and I'm healthy and happy and so grateful to Dr. Burzynski.
Dr. Burzynski saved my life.
Do you believe you would be alive without Dr. Burzynski?
I know I would not be.
Then 60 days later, we did another x-ray. Gone, nothing in there. And, you know, what he discussed it with us, it just made perfect sense that, you know, if you're not working for the FDA or the drug companies, there's a way to cure cancer.
For some reason, they don't want to have cure of cancer.
I'm 25 years old at the end of the month, and there's been a cure for cancer that long. Plain and simple.
Why we don't develop cancer, all of us, is because we have protective system. We have antineoplastons who will immediately force these malignant cells to die by working on the genes.
So over the course of the last 8 years, annual MRIs have confirmed all that's left of the tumor is scar tissue, and I've been off of treatment for that entire time. So Dr. Burzynski cured me of a brain tumor.
It's as if she had a bacterial infection and Burzynski treated it with antibiotics.
The FDA has made a list and decided who can live and who will die. I guess I didn't make that list.
I've had no chemotherapy. I chose Dr. Burzynski instead after a lot of research and a lot of searching. I was told that the chemotherapy that I could have would work for a while, but there was no cure for my cancer. I've been in remission since 1989.
Now the FDA is saying to me, no, your doctor is a criminal, he should be put in jail, and he needs to be shut down. This is criminal.
In 1991, the National Cancer Institute sent a panel of experts to Houston, and they determined that in each case of advanced brain cancer, Dr. Burzynski's treatment caused anti-cancer effect. I should also point out there has never been an allegation, concern, or a whisper that his treatment is harmful or toxic, unlike many conventional drugs.
It constitutes nothing less than one of the worst abuses of the criminal justice system I've ever witnessed.
An MRI 6 weeks after we started Dr. Burzynski's treatment revealed no tumor. We were very overjoyed.
There's a government institution that disseminates false information and is not looking out for the welfare of the people. You know, ladies and gentlemen, I swore an oath 11 years ago, and I think most of us in this room swore it at one time or another, to uphold the Constitution. It says life right in the beginning.
This is Mike Adams reporting for InfoWars Nightly News from the Burzynski Research Institute in Houston, Texas. And we are here to talk about the suppression of medical science. The history of cancer research is something very different from what you've been told, and certainly very different from what the mainstream media has reported. There are cancer cures that really work, and some of the most innovative and pioneering research in the history of our world is being done right here at the Burzynski Clinic in Houston, Texas, and yet the Texas Medical Board attempts to suppress the research. The National Cancer Institute alters the research findings. The FDA tries to go after them time and time again, but failing because the truth will always win out. And the truth is that this is one of the most important institutions for cancer research in America today. Now, we sat down to talk with Dr. Stanislaw Burzynski to get more information about why that's the case. Let's see what he has to say.
They will harass you mercilessly for trying to be innovative, for saving people's lives, for publishing your results so that the others may follow you. So that's what they do. And they should be exposed, because this is also some type of criminal activity. Because they are doing this, the other doctors cannot follow up what is the right way to treat the patients. When we began our treatment on genomic switches, well, we are really pioneers in the entire world. Now, many other researchers are going this way, and people begin to understand. You have articles, you have TV programs about it. Now it's just a matter of time when the breakthrough will occur and the new approach to cancer treatment will be firmly established. The research ultimately was proven to have practical application to treat patient, and then obviously I became competitor, quote unquote, to the other big guys in the field. So then the problem started.
It turns out his discovery threatened billions of dollars in profits currently generated by the cancer industry, an industry which actively seeks to suppress treatments that actually cure cancer.
They were looking how to take away my invention, and they thought that the best way to do it would be to prove that it doesn't work in the clinical trials which we sponsored. So that's why they use lower dosages. That's why they discontinued the treatment after about a month, knowing that obviously this is too short time to have any good results. So this is pretty much criminal activity, because people came trusting that they should receive adequate treatment, and they did not. So I think there should be a day when these people will be taken to court as simple criminals, because that's what they are. Okay. Well, it's not up to me to do it, but that's what I think the justice should be done, and that's what they should face, because they did it for money. Basically, we are fighting for the other doctors. Probably they don't understand it yet, but we are fighting for the freedom for the other doctors. The doctor should have the right to choose the best treatment for his patient, and he should not be really told by the lawyers, by the people who have nothing to do with medicine, what to do. This is up to the doctor and patient. And as long as the doctor is using a reasonable approach, he should be able to do it. That's what was typical for medicine for centuries, and that's what America deserves. Not really the doctors to be robots who are told by the clerks from Washington or from Austin, Texas, what they should do. The doctors know how to take care of the patient. They should be given free hand, especially when dealing with advanced disease. That's what I'm fighting for. I'm fighting to give freedom to the doctors and freedom of choice to the patients who require treatment, who otherwise will die because there's no treatment available for them.
Dr. Burzynskis developed a cancer treatment called anti-neoplastins, and it caused brain tumors to vanish in many children.
There's nothing more important or rewarding to see some patients who arrive here literally told that they had days to weeks to months to live, and the decision to come here has saved their life, has given back to themselves, their families, their communities, their churches, their workplaces. I mean, they're becoming productive members of society. So to see that is a reward that I cannot put into words.
Some of the notable innovations that we have at the Burzynskis Clinic are expanding our tumor profiling. We look at the tumor as a whole. We look at the genes involved. We look at the tissue. We sequence the human tissue and we see all the molecules that are involved there. It's not just the same type of lung cancer, adenocarcinoma per se. It's got a lot of different subtle varieties. So we look at different biomarkers in the blood and we see exactly all the different variations that are going on. And right now we're even going further. We're going further by analyzing these circulating tumor cells of that cancer. So not only do we look at the tissue, we look at the circulating tumor cells to better formulate a treatment plan.
They were convinced that when you are dealing with stage 4 cancer, obviously you can't cure it. There's only palliative treatment, and whatever you can do, try to decrease the tumor, use such and such combination for everybody, and that's what you do. And after you, for instance, expose patient to, say, 3 different lines of chemotherapy, send the patient to a hospice or send patient to clinical trials. So that's how they were educated. And they feel that they do the best because they were taught this in medical school and then in their training. And if somebody was trying to do something else, he has been punished. He has been investigated, his colleagues would attack him, and his license was in jeopardy. We are into the system of genomic switches, which are regulating cancer and many other processes like, for instance, aging, memory. They are involved in such illnesses like Alzheimer's disease, for instance. So basically, this is more or less epigenomic regulation of the gene activity, which is playing perhaps the most important part. And basically, this is a system of the switches, molecular switches, which is regulating our life.
It's an era that's been a little barbaric, and we're moving away from that, hopefully, especially with the surgeries. It used to be, let's just perform a radical mastectomy for everybody with breast cancer. It was called the Halsted mastectomy. The more the merrier. Huge disabilities. Now we're moving closer to perhaps a lumpectomy. And the best surgeons nowadays realize that surgery for cancer is not even probably going to be an option in the future. It's going to be the molecules that are in the genes controlling the cancer. We have to take care of that.
Now what we can do, we can take care of the changes which occur in our life, which is majority of cancer cases. And the first event in such patients is typically not mutation, but turning off the gene which protects against cancer. This is like tumor suppressor gene which is turned off. When this happens, this would lead to mutation of the other genes, because part of the job of these tumor suppressor genes is to get rid of the cells which contain mutated genes. And if these genes are silent or switched off, then it's not going to happen. So finally, the patient will have more and more cells which will have mutated genes, and this can lead to cancer. So, and such cells which contain these mutated genes, which were created during patient's life, can be completely eliminated through the type of treatment which we are using, which means using medications which work on the genes, combinations of gene-targeted therapies. And once you eliminate such mutations, once you eliminate malignant stem cells, then the patient is cured. The patient can live normally over 20 years without having any sign of cancer. And that's what we are able to prove among our patients.
Instead of giving him grant money to expand his research, the United States government, along with the Texas Medical Board, decided to persecute Dr. Burzynski and try to throw him in prison.
I thought I was fighting the right cause, because I knew that we can help desperate cancer patients. That's why I decided to fight. I knew that I was right, and I have a conviction that finally, if you are right, you're going to win. And it's not only in the field of medicine. You can see this in many other fields, where these people who really were causing a lot of problems, a lot of suffering, they were not punished. They got financial awards from they do. They wanted to have big chunks of money coming from one of the pharmaceutical companies because they knew that they would receive royalties. Well, it happened the other way. They lost. The big company which was trying to give them money now was purchased by another company. So whatever they planned to do did not work, but it could work. Of course, I could be now sitting in prison if I wouldn't mobilize the people to help me. So it's just coincidence or pure luck that I'm not really subdued by these guys, because they have a lot of power, which I didn't have.
Today, after defending himself against countless FDA accusations of fraud, Dr. Burzynski continues to treat cancer patients, many of which are cured of their cancers.
Our patients, for the most part, have a great quality of life, especially some of the children who were treated with our antineoplastons. They essentially had little to no side effects. A lot of children that are treated with the conventional oncologic therapies, they unfortunately, their growth is stunted. They might have some cognitive deficits. But with a lot of these folks that are now adults, they have only health, great health.
People are realizing something is not right, and they would like to make some changes. Hopefully we see some changes coming, and these will be changes for good.
So there you have it, the history of the suppression of medical science, but yet hope for the future that these technologies may be embraced so that they can help the many millions of people around the world who deserve to have treatments that really work for cancer. This is Mike Adams, the Health Ranger, reporting for InfoWars Nightly News.
After being so incredibly persecuted and prosecuted, basically the FDA will change their mind, and he will conform to their rules, and they will allow testing, and they will give back his license. Let's look at the 217 hearing results.
Where you as the board were at the time of executive session, I believe there was a pending motion. I think probably need for a restatement of that and then proceed from there, sir.
So we're going to go ahead and entertain a motion again. Mr. Gargo?
I believe there was a motion that was pending. That motion, if you would restate it, I believe it was for board staff's order, if I'm not mistaken, and there was a second on it. So I think the best thing to do is restate it and verify that that motion is still pending, and if the second remains effective, or how you want to proceed. But you're going to have to do something with that because there is a second on board from a procedural standpoint.
Okay, so there's a motion before us. Is the second still remain?
I withdraw my second.
Okay, is there anyone else who would like to second the motion? Seeing no second, the motion fails. Are there any other motions?
Mr. Chairman, I do have a motion.
Please proceed.
My motion would be that with respect to the case in question, as to the penalties, that we issue a public reprimand, a suspension of the doctor's license for a period of 5 years, probated, 12 cycles of chart monitoring relating to billing, taking the JP exam, 72 hours of continuing medical education divided between record keeping, diligence, risk management, and ethics, proper ownership disclosure of the pharmacy, a revision of the consent forms, a $40,000 penalty, plus $20,000 restitution. I believe it was patient G. And that would be my motion to conclude.
And just before a second on that, Dr. Zaffron, clarification. I believe, was there an informed consent element of that?
There was. Did I not say that?
Yeah. You did. Well, just to be clear on it, how did you want that to be done? And let me tell you why I asked you that, Mr. Denton. When you say an informed consent, what has been done historically in a couple of cases is that you ask for the revised consent forms to be reviewed. Normally it's by the medical director to be sure they contain the disclosures that are necessary or you believe are necessary as a board. And then the other requirement is that those, you make sure that they're in the patient's chart, which I probably as a matter of course is done, but again, you would just say that kind of as a belt and suspenders. So those would be something that would be verifiable that the patients were being properly consented, if that is what you were really intending.
The revised consent forms that I'm speaking of would be approved for the Texas Medical Board and be a part of the patient's files. So I thought that went without saying, but thanks for the clarification.
Well, I think it does, but again, for the purposes of the respondent, Dr. Burzynskis, his lawyers, the people here, new board members, want to clarify that that's our standard way of doing these consent forms as you put forward. I don't think some folks have heard that before, so again, it's a little more explanatory than we might otherwise do.
I think the form of the motion has to be to adopt the findings of fact, including the law, and modify the board order as written.
No, it can be no, it would be findings of fact and conclusions of law with Mr. Dent putting in new terms.
I second that motion. Before we second the motion, let's make sure that the motion is clear the way it needs to be. Go ahead, Dr. Holliday.
I was actually just about to say that, and I think that we need to, as a board, adopt the findings of fact and conclusions of law as presented in the proposal for decision, and then we can discuss the order itself and the sanctions within the order.
Thank you, Dr. Holliday, and let me revise or explain my motion. It did include the adoption of the findings of fact and conclusions of law found in the order, and what I have proposed is the proposed penalty as a result of those findings of fact and conclusions.
Which would be appropriate because you are not adopting the board staff's order, you are adopting the findings of fact and conclusions of law, and you're putting forward new recommended sanctions, correct, Mr. Denton?
Absolutely correct.
All right,
correct.
That's a clean motion, thank you.
Okay, so we have a motion before us. Is there a second? Okay, now I second. Okay, thank you, Dr. Webb. Discussion.
A bit of clarification. Does the chart monitor, not the chart monitoring, the continuing education that you're proposing, Mr. Denton, does that include the Colorado Physicians Education Program?
You know, I had not included that in my motion, although I would consider an amendment to my motion if that's something that someone wants to bring up.
I would consider that as an amendment to include the CPAP course as stated in the staff's original order.
So is that in addition to the 72 hours of continuing education that I proposed?
Yes.
Okay, I would accept that amendment to my motion.
So there's an amendment to the motion. There's a second. Any discussion?
As far as the CME, the 72 hours in person.
But we can only do.
So yeah.
Are you clarifying or amending? Because we can only do one amendment at a time. Are you?
I'm clarifying the CME.
The CME, would it be a standard one, or did you envision it and it didn't say in your motion in person? And I will be again very clear. Our CMEs are normally not in person unless that's specifically.
Had I not have accepted the previous amendment, I would have been okay with in person. But I think since we are going to include the CPAP course in Colorado, that these would be the standard.
Okay. So before us is an amendment to the original motion. That's before us. It's been seconded. Any further discussion on the amendment? Seeing none, all those who are for say aye.
Aye.
All those opposed, nay. The amendment to the motion passes. We go back to the original the original motion as amended. Is there any discussion on that? Dr. Holliday.
I have discussion on that because on the proposed order from the staff under ordering paragraph number 7, it talks about 44 hours. Mr. Denton has made it 72 hours, and it's categorized and broken up into certain topics of informed consent, medical record keeping, topic of risk management, supervision of delegates, etc. So I guess my question is, are we going to follow the same proportional breakdown of the topics to receive CME in? The question.
Mr. Denton, is that what you were envisioning with your motion?
That was not a part of my motion.
Okay, so Dr. Holliday, would you like to make that as an amendment to the motion?
I guess my motion, though, has already been made, seconded, and passed.
No, the amendment has passed. The amendment to the motion has passed.
I apologize.
So
maybe you need to make clear to me what it is.
Yeah, so your motion right now has been amended to specify some of the, in addition to the CME courses, to CPAC. So that's the motion that's before us right now, and we can entertain additional amendments to the motion as is deemed necessary. Dr. Holliday.
So my question really is just a clarification of what's the breakdown of the 72 hours of the topics to be included in ordering paragraph.
Well, I think Mr. Denton had 4 topic areas that he specified. Normally when it's done like that and you specify the areas, it is an equal division among the topic areas. So the 72 hours proposed would be equally divided among the 4 topic areas. That is standardly how board staff would draft it with a motion as tendered by Mr. Denton. And I think for clarity, Mr. Denton, would you specify, I believe there were 4 areas, sir?
There were. It was record keeping, diligence, risk management, and ethics.
And proposing that be divided equally?
I think I think when you say diligence, is that like more akin to, I think, what the physicians would call a risk management topic?
Well, I had included risk management in that. So
I think, though, it would need to be titled risk management because you're not going to find courses that are entitled diligence, and you would not necessarily want to put something in there that was created an impossibility to comply, but you could have risk management with some courses which by definition risk management I think involves diligence from a professional perspective.
With that being said, then it would be divided equally between record keeping, risk management, and ethics.
May I make a point?
Okay, Ms. Atterbury.
The CPAP course is ethics. So you may want to do a different type of, unless you just want to have additional CME, which was not in the original.
You know, I have proposed this and going to stand by that proposal unless someone's got an amendment they want to make to it.
Okay. Dr. Holliday?
Frank, may I offer a friendly amendment to your proposal? On the topic of CME and your 72 hours of CME, I would like to make a motion to amend that to include equal division of the CME into the topics that would be 1, informed consent, 2, medical record keeping, 3, supervision of delegates, and 4, the topic of patient communication.
Second.
Is there a second to that?
Second.
All right,
I hadn't accepted the amendment yet, have I?
Well, you don't have to. It have to be voted on. So there's an amendment to the motion, and that amendment is before us as it is delineating how we're dividing up the 72 hours of CME credit. That motion has been, the amendment to the motion has been seconded. Is there discussion on the amendment that's being proposed?
There is some clarification or question I have, and just for the record, I don't have any opposition to the amendment being made. But one of the things you mentioned was record keeping, which was already a part of my original proposal.
Right.
Risk management. I'm not sure risk management doesn't cover 1 or 2 of the areas that you brought up, or does it? I totally agree with respect to the supervision, the delegation and supervision issue. So I'm trying to figure out what you're adding to my original motion. I've got 72 hours divided between record keeping, risk management, and ethics. So are you adding to, or are you?
No, I'm just making it more clear.
that this is still 72 hours, but it include which topic?
It's 72 hours that include, Dr. Holliday, why don't you repeat the 4 areas?
So to restate it, it was 72 hours of continuing medical education in the following topics: informed consent, medical record keeping, risk management, supervision and delegation, and patient communications.
And are you deleting ethics?
Ethics is already in the CPAP.
In the CPAP,
Ethics
correct.
is being managed through the...
So basically, you're offering a substitute list of subjects that is covered in the 72
That is
hour,
correct.
which I am totally in agreement.
Okay, so before us is the amendment to the motion that's been seconded. Is there any further discussion? Seeing none, all those in favor of the amendment to the motion, please say aye.
Aye.
All those opposed, say nay. So now we are back to the motion as amended. Is there any further discussion on that? Seeing none, all those in favor of the motion as amended, please say aye.
Aye.
All those opposed, say nay.
Nay, and I do want to make a very short comment.
Go ahead.
I
Mr. Garvin.
believe that the staff provided a truly informed and accurate information based on the proposal for decision. They did the calculations based on actual violations and the guidelines that are basically associated with what we do every day. I see this is basically throwing those guidelines out the window. All the calculations that they did were for naught, and that's why I voted no. I think otherwise, if we would have continued with how it was proposed in my earlier motion, I would not had any problem with it. I just want to make that for the record.
Thank you, Mr. Guardo. So as it stands, the motion has passed and the proceeding on this issue is done.
Thank you. Thank you, gentlemen.
Thank you, board.
All right. The next item on the agenda, number 3, Mr. Midhat Michael, MD, SOA number 503-15-4894.
All right.
Can you explain to me in 2 sentences what just happened? Can you see what happened? I'm really sorry about that. Very dangerous apparatus. I'm really sorry.
Let's go for
As we are preparing for the next, members of the board, as we are preparing for the next item on the agenda, please feel free to take 5 minutes to go and grab some lunch, and we'll go ahead and proceed with the working lunch.
So as we see, there is a God, and there is justice. It has to be fought for on a daily basis, but it can be achieved. What will happen to my case? How will my case turn out? Will I find such justice as well? Only time will tell. Keep in tune.